I now have here with me Dr. Reema Sircar, a very eminent doctor and a leading IVF specialist. And today, on World Mental Health Day, we are going to talk with Dr. Sircar about some of the issues that she goes through with her patients. So, welcome, doctor, to this show, and thank you for your time. So, tell me something, doctor. Mental health, it's been increasingly a topic of conversation, especially since the pandemic. But have you doctors forever been talking to your patients about mental health? For instance, when you talk to a patient who is undergoing fertility treatment, I understand that, the mental frame is a large part of it because, the treatment might work. There are chances it might not. They might have to try again. What are the processes involved in the mental conditioning part of it?
Yes, of course. Thank you, first of all, Shamishta, for having me here. So, as you pointed out rightly, that mental health in versus infertility. So, the kind of patients I deal with, like you yourself mentioned, subfertility or inability to conceive. If you come to think of it, Shamishta, it as such is as much a mental or an emotional problem as much as it is physical. Just think about it, the inability to do something that comes so naturally to others will definitely play with your mind at some level or the other. So the patients that come to us, they are, whenever they start this journey with us, this seeking help journey, it is definitely mental health is at the core of it. They're kind of entering an emotional marathon, and right from the time when they come to know that there is something wrong, and while they're trying to figure out diagnosis, the making the visits, multiple visits, the doctors, and finally coming to know and preparing for this journey ahead and trying to educate yourself, preparing for it, and then finally when they come for us to us for IVF journey, then going through these hormonal injections, and if they're going for IVF, then embryo transfer, ovum pickup, and that wait of results of 2 weeks, that can be, extremely emotionally taxing. People with good mental health, I would say, and emotional well-being is not only a supportive treatment anymore. I would say it is an essential component of the treatment that a doctor might have to offer to their patients. And statistically and clinically also, we've seen that these patients who are more optimistic and who have a better emotional well-being, they show more adherence to treatment, they are more resilient, and of course, and sometimes that can result into better fertility results also. So mental health is definitely very, very important.
Do you advocate things like meditation or, joining any kind of peer group or, I understand family is always supposed to be a supportive group and you advocate that. But what are the other kinds of support systems that you advocate?
Oh, we advocate anything that helps. The idea is to get the couple pregnant, right? So anything that has a scientific basis, we never stop them from doing anything. Like you yourself said, nowadays infertility or subfertility is more of a lifestyle disorder, and it is hugely related to stress that every couple is facing. Both the partners are working, and more than often, not they are both having long shifts and not having time for each other. By the time you reach home, you're so stressed. You're so
Not so much available for each other as they
Yes.
used to be.
So,
Yeah.
so meditation definitely, if whatever time you can find. I mean, it doesn't have to be a fancy room or a fancy setting, just some me time, let's say, and all those rituals that you can do for yourself. Maybe have a better diet, maybe look back into your nutrition and cut off those, say no to all those Swiggies and all those platforms. Just give some anything that works healthy towards yourself. Talk to yourself, maybe journaling, talking to a friend, a family, if there is someone that you can turn to who can be non-judgmental and listen to you. And most importantly, your equation with your partner. That
Correct.
matters a lot because these things, they are socially also, they are like a taboo even till date. So a lot of times there can be self guilt that can come into this, and self doubt, and there can be misunderstandings with your partner. There are insensitive comments from the unsolicited comments from the people around you. So you need to have a better understanding, talk to your partner, talk to your family, seek support in whoever your support system is, identify it first. And yes, nutritional health is important, mental health is important, taking care of your body's BMI and your move around, add some sort of activity. Don't, if you've not had time before, see, talk to yourself that career is important, but so is fertility. So categorize your day into things that you will do for yourself. So we advocate all of that because preparing for that journey is equally important as the fertility journey with the doctor itself, right? So we do that.
क्या आप एक माँ हैं या माँ बनने वाली हैं?
क्या आप अपना ब्लड ग्रुप जानते हैं?
क्या आप जानते हैं कि भारत में 5 से 10% महिलाओं का ब्लड ग्रुप नेगेटिव होता है? जैसे कि ए नेगेटिव, बी नेगेटिव, ओ नेगेटिव या ए बी नेगेटिव। तो अगर आपका ब्लड ग्रुप नेगेटिव है और आपके बच्चे का ब्लड ग्रुप पॉजिटिव है, तो डॉक्टरों का ऐसा मानना है कि अगले बच्चे में कुछ कॉम्प्लिकेशंस हो सकती। पर घबराने की जरूरत नहीं है। इसका एक समाधान है जो आपके बच्चे को सुरक्षित रखता है। तो अपने डॉक्टर से सलाह लीजिए और अपने आज और आने वाले कल का ख्याल रखिए। धन्यवाद।
भारत सीरम्स एंड वैक्सीन्स लिमिटेड और मैनकाइंड फार्मा लिमिटेड द्वारा जनहित में जारी।
So, Doctor, you mentioned several points, and I'll pick out some keywords like someone who is non-judgmental, work with that kind of support group. But society as a whole is very judgmental, especially of women. In our country, something like postpartum depression or inability to conceive naturally, it's still considered taboo. It's still considered like a personal, failure. So, as a doctor, on this very important day where we prioritize mental health, is there any message? Because you work with patients all the time, 365 days, you see their angst, you see their agony. Is there a message that you would like to give to society at large, which is so judgmental of women, especially body shaming them after, they give birth? Is there something that you would like to say from your perspective to people at large who are viewing this interview?
Yes, of course. See, of course, change will not come in one day, but the more we say it and the more people need to hear this. Yes, let them be. As it is, the couples that come to me who I deal with, they're going through a lot. Nobody brings any medical condition to themselves. Nobody wishes it upon themselves. They just get, just like any BP, sugar, or heart disease or any other problem. They have also just been trying to absorb the shock of this medical disorder or medical, let's say, condition that has just been broken upon them. So please do not add to that agony. Just like how you would support any other physical disorder, please support these people of your family or these friends, or as someone outsider. Don't make their business is not your business. Let them deal with it. They will seek help if they want to stop, even in simple things. Just when, don't feel too conversational about it. These people,
Yeah.
we are telling them to reach out if they need help. If they are not talking about it, then let it be. Not everything needs to revolve around this particular topic. Help them distract, help them seek help with physical activity, promote those kind of things, take care of their health in general. So even to people, like I see, like you asked, when I mentioned, I see so many times misunderstandings creeping up between the partners also, between the couple also, because it becomes like a blame game so many times.
Yeah.
So not everyone processes this kind of information similarly. Whilst one partner may be too enthusiastic about taking all the supplements, the other may just withdraw and maybe process, taking time to process. And then there is this conflict that comes up. Okay, you are not being supportive enough. So talk to each other. And then, most importantly, I've seen that couples make this fertility journey, their entire world. They
Yeah.
keep everything on hold. Pehle ye ho jaye, let me just figure this out, and then I will do this. And then
Like I'll take my exam and do, it's like an
yes,
exam, you're preparing.
career or anything. Yeah, it's like they keep their life on hold, and God forbid if it doesn't go as planned, then that I kept my life with it. I on hold for this, and even this is not getting figured out. Please try to take it. I know it's easier said than done, but as much as you can condition yourself, take it just like any other disorder. Take a visit to a fertility doctor or the treatment journey like any other disorder, and please do not keep life on hold. Take out time for your friends, for those social outings, for your hobbies, and do other stuff also while you are dealing with this. And to friends, while they are trying to keep their life normal, please let them be, right?
Doctor, very instructive, everything you said. And I think you also answered the next question that I was going to ask that, God forbid that your treatment doesn't work out. You still have a life to live with each other. And, you can look towards adoption, you can look towards so many other things. So that's, I think, the mental conditioning that we are also addressing through our platform. And since we are a sports platform, we work a lot with athletes, and athletes increasingly are going in for later pregnancies because they don't want to put their careers on hold. But I think that's for a lot of women across the board these days. Doctor, I'll ask you my last question. Now, you work with patients and their mental health throughout the year, 365 days. So, what would you say is, anyways, the significance of a day like World Mental Health Day, which we are celebrating today? Is there at all the need for such a day?
Oh, yes, of course. Like I said, the more you voice it, the more people do need to hear it. The more you talk about it, the more we are normalizing it. When I started my practice, people wouldn't even talk of infertility. Men especially, they wouldn't even come forward to accept it. What we did was
It's a big ego issue, I think.
it was. And what we just did was we talked more and more about it. We tried to take fertility sessions, awareness sessions in the camps, in mandirs, temples, through NGOs, what all we have done. And we talked about it, all these fertility consultants. And now we have reached a stage where at least we are getting couples coming forward for their treatment, even within 3 to 4 years, 2 to 3 years of them not able to conceive. Earlier, it used to be, past mid 40s only when couples used to come for help. So let's talk about it. Mental health is an issue that needs to be talked about. But also, I have a word for your previous question. Like you said, careers are being kept on hold. So here, as an IVF specialist, as a medical professional, I would want to say that we need to talk more about egg freezing. So there is an option available medically. Put your eggs in freezer, let's say, to make it very, very simple. It's not as complicated or not as costly an affair as it is perceived to be. At least go talk to a fertility consultant. It does give you a lot of freedom, let's say a reproductive freedom, and while you're sorting out other aspects of your life, your career, education, and whatnot, so you can still come back to your reproductive life when later in life you need to. And also counseling goes a very long way. We in even in my hospital, the place where I work in the IVF, I keep reminding myself as well as my staff that it's not only uterus and ovaries that we are dealing with. There is a whole person behind
A
it.
whole person,
Yes,
yes.
because in hospitals, especially, so much we don't do it intentionally. However, it's a super specialized field, and sometimes we may get so engrossed with the problems or the pathologies itself that we may forget that there are feelings behind it. So hospitals need to be more sensitive. We have counselors sitting here in our hospitals where patients talk and they feel very happy about it. Then family needs to be more supportive. And I can't say it enough, peer groups, because a lot of times when we talk about it or the friends talk about it, then there is this response, oh, how do you know about it? So to have people who've undergone the same journey, have similar kind of problems, their couples may feel more heard, better understood. And
Same generation, that kind of thing. Yeah.
so, we need to speak about it. We need to have groups about it, and nothing that we do can be more than enough. Yeah.
Thank you, doctor. It was most instructive to speak to you. And what we are taking away is to speak is to protest against the silence around this subject. To speak is to create awareness. To speak is to generate mental health. So thank you, doctor, for being with us this Mental Health Day. And stay tuned to Revsportz for more on this.
আপনি কি একজন মা বা মা হতে চলেছেন? আপনি কি নিজের ব্লাড গ্রুপ জানেন? ভারতে 5 থেকে 10% মহিলার ব্লাড গ্রুপ নেগেটিভ হয়, যেমন এ নেগেটিভ, বি নেগেটিভ, ও নেগেটিভ বা এবি নেগেটিভ। তো যদি আপনার ব্লাড গ্রুপ নেগেটিভ হয় আর আপনার বাচ্চার ব্লাড গ্রুপ পজিটিভ হয়, তবে ডক্টররা মনে করেন যে প্রেগন্যান্সির সময় আপনার শিশুর মধ্যে কিছু কমপ্লিকেশনস হতে পারে। কিন্তু চিন্তার দরকার নেই, এর একটা সহজ সমাধান আছে যা আপনার সন্তানকে সুরক্ষা দেয়। তাই আপনার ডাক্তারের সঙ্গে পরামর্শ করুন এবং ভবিষ্যতের জন্য সতর্ক থাকুন। ভারত সিরামস অ্যান্ড ভ্যাকসিনস লিমিটেড এবং ম্যানকাইন্ড ফার্মার দ্বারা জনস্বার্থে প্রচারিত।